Gum disease and diabetes, a two-way street. The objectives covered in this presentation will define plaque and decay and their effects to the oral cavity, identify the signs of gingivitis and periodontal disease, recognize the oral side effects of common medications used to treat diabetes, identify products that help treat dry mouth and their importance, demonstrate proper toothbrushing technique, demonstrate proper flossing, and identifying sources of fluoride and their importance. Let's begin by talking about plaque. Plaque is a sticky film substance that contains bacteria and sticks to our teeth surfaces. Whenever this biofilm accumulation is left on our teeth for long periods of time, it becomes calcified and hardens onto our teeth, usually going unnoticed as a colorless film until it hardens into plaque. When bacteria goes long periods of time without being disturbed and the bacteria continues to stick to the tooth surfaces and gums, the accumulation eventually hardens into calculus. The visible accumulation can happen supragingival, meaning above the gum line, or subgingival, meaning below the gum line. Calculus buildup can be mechanically removed during a regular dental cleaning visit. Now let's move on and talk about tooth decay. Tooth decay, sometimes called cavities or caries, are caused by a combination of factors. Bacteria in the mouth, frequent snacking, or sipping on sugary drinks are all causes that can permanently damage the hard surface of our tooth. If plaque is not washed away by saliva or brushing, the environment in our mouth becomes acidic and cavities start to form as a result. A neutral pH of the mouth is 7. When the pH of plaque drops below normal or less than 5.5, the acidity starts to dissolve minerals and destroys the tooth enamel. As a result, small holes of erosion will form. Over time, they will become larger until a large hole or cavity appears. Sugar tends to attract bad bacteria. The two destructive bacteria found in the mouth are Streptococcus mutans and Streptococcus cerebrinus. Both feed on the sugars we eat and form dental plaque. The good news is there are a few ways to prevent decay. Brushing with a toothpaste that contains fluoride, dental sealants as a form of preventative care, receiving fluoride from tap water, rinsing and cleansing the mouth of any food debris, keeping up with your regular dental visits, and considering your options of different fluoride treatments are all great ways that can help prevent decay. A big factor of preventing tooth decay is our diet. It is important that we avoid the consumption of certain foods and drinks that cling onto our teeth for long periods of time. Acidic and sugary foods, along with carbs and starch, are all more likely to cause decay than the foods that are more easily washed away by saliva. These are typically foods that we want to try to avoid since they are more likely to cling onto the tooth surface. Now that we've talked about plaque, let's go over gingivitis. Gingivitis is a form of gum disease that happens when plaque, a naturally occurring sticky film containing bacteria, builds up on the teeth and causes inflammation of the surrounding gum tissue. Plaque produces toxins that irritate the gums, make them red, puffy, and cause them to bleed. Some symptoms of gingivitis are swollen gums, gums that easily bleed, puffiness, receding gum line, and tenderness. There are multiple factors that can cause gingivitis. Smoking being at the top of the list as one of the greatest risk factors associated with gum disease. Smokers are more likely to suffer from gum disease than people who don't smoke. Poor oral hygiene or not fully removing plaque. You may be missing the plaque found around the gum line. It is important that when you brush, you also cleanse the gums. Stress is also on the list. Stress can weaken your immune system and negatively impact your ability to fight infection, including gum disease. Hormonal changes, including puberty, pregnancy, and menopause. It is important to take extra care of your teeth and gums during these physiological changes to prevent gum disease. Poor nutrition deprives the body of important nutrients and makes it more difficult for the body to fight infection, including gum disease. Medications can also have adverse effects in the oral cavity, with dry mouth being one of the most common side effects. Many chronic diseases such as diabetes, cancer, and HIV impair the body's ability to fight infection and can cause gingivitis. Preventing and controlling gingivitis. By practicing good oral hygiene habits such as cleansing your gums by brushing twice a day, flossing, making sure that you get that floss below the gum line, and keeping up with your regular dental visits are all great ways to prevent the development of gingivitis. So what happens if gingivitis is left untreated? Well, it is important to remember that gum disease happens in stages. Gingivitis is the first type of gum disease we encounter, which can cause the gums to feel pain, severe bleeding, and swelling. The disease is still reversible at this stage and can usually be eliminated by careful daily brushing and flossing. If left untreated, gingivitis progresses into bone loss and teeth can be in danger of falling out. This stage is called periodontitis.
Periodontitis is most commonly known as gum disease, and this is when the inflammation of the tissue around the teeth causes shrinkage of the gums and loosening of the teeth. Plaque and bacteria around the tooth triggers our body's immune response for a reaction. Clinical signs and symptoms of gum disease include inflamed gums, bleeding, loose teeth, as well as foul breath. The progression of periodontitis. In its early stages of periodontitis or the late stages of gingivitis, it is reversible. But once the disease starts to affect the bone and the tissue, periodontitis then becomes irreversible because we cannot grow back bone. Diabetic patients are put at a greater risk to develop gum disease since they do not have the antibodies to pathogens associated with periodontitis as those who don't have diabetes. Keeping sugar levels low will help control/slow down the rate of progression. Oral effects include dry mouth, enlarged gingiva, and bad breath. Treatment would be to increase your oral hygiene, control your blood glucose levels, and most importantly, visit your hygienist.
Toothbrushes. There are manual toothbrushes and electronic toothbrushes. A soft toothbrush is the best for removing plaque and debris and for brushing along the gums. You want to replace your toothbrush at least every 3 months because the brush bristles become frayed and they won't clean your teeth as well as a new toothbrush. Also, an extra soft toothbrush is recommended for people with very sensitive teeth or otherwise people with recession. Electronic toothbrushes are the best for aggressive brushers because they do not require a lot of pressure. The rotating motion of 360 degrees makes them the most effective at reducing plaque and gingivitis. Now, how long should you be brushing? Brushing should be done for at least 2 to 3 minutes, and you brush in the morning and at night. But the most important time to brush is the nighttime. Now, there is a proper brushing technique, and the name of this technique is called the Bass method. What you do is you take your toothbrush and you place it at a 45-degree angle to the gums, and you gently move the toothbrush back and forth in short strokes, and you brush the outer surface, the inner surface, and the chewing surfaces. And here in a little bit, I will give you guys a quick demonstration on the Bass method. The Bass method, you want to take your toothbrush and angle it at a 45-degree angle. And you want to do small back and forth strokes, at least 3 to 2 teeth at a time. I'm going to move on to the next set of teeth. And here I am brushing the outside surfaces of the teeth. At some point you want to move your toothbrush just like this. Continue to brush at a 45-degree angle. And I'm going to move on to the chewing surfaces. And really take your time when brushing the chewing surfaces. A lot of food likes to get stuck there. And don't forget to brush the very back of those teeth. When you get to the bottom, same thing. Angle your toothbrush at a 45-degree angle. Brush in small back and forth strokes. 2 to 3 teeth at a time. toothbrush, keeping it at a 45-degree angle. Brushing along the gums, then brush the chewing surfaces back and forth, brush the back, and also very important, brush the inside. Same thing, small back and forth strokes, keeping it at a 45-degree angle. And when you get to the inside, which I like to call it the tongue side, I like to brush like this, still keeping it back and forth. And also when you brush the top, the inside surfaces, you want to do back and forth motions. Flossing, my favorite. Proper flossing is important because toothbrushing alone cannot accomplish biofilm removal between the teeth. Flossing is done before brushing to allow the fluoride from the toothpaste reach the teeth in between. Flossing should be done at least once a day, whether it's in the morning and at night, but there are some people that prefer to floss right before bed so they go to sleep with a clean mouth. Now I'm going to give you guys a demonstration on how to floss. I have my piece of wax floss ready to go. I use my arm to measure the floss, and usually you want it to be 12 to 15 inches long. You want to take the floss and wrap it around your middle fingers. You don't want to wrap it too tight because you don't want your fingers to turn purple. And then you're going to use your index finger and your thumbs to control the floss. When inserting the floss, you want to do it slowly. And then you want to curve the floss around the tooth in a C shape, and also make sure you go beneath the gums and slide it up and down. Next up, you're going to do the same thing for the other side. Hug the tooth in a C shape and go up and down all the way beneath the gums. Next up, I'm going to give you a demonstration here on the molars. Insert it slowly. Wrap it around the tooth in a C shape and go up and down. You'll do the same thing for the other side. C shape and move the floss up and down. When you floss the top teeth, you want to direct the floss upwards and insert it slowly. Once again, curve the floss around the tooth in a C shape and go up and down. Same thing for the other side. Types of floss: regular floss, floss picks, wooden tips, interdental brushes, and the water flosser. Regular floss comes in waxed or unwaxed, and the interdental brushes are good for cleaning white spaces. Toothpaste. There's tartar control toothpaste, which helps keep tartar from forming on the teeth. Sensitivity toothpaste. It helps reduce teeth sensitivity, whether it's to hot or cold. Whitening toothpaste. It helps whiten the teeth by removing and or preventing stains from forming on the teeth. Plaque and gingivitis toothpaste reduces inflammation and bleeding of the gums. And fluoride toothpaste helps strengthen the enamel and fight tooth decay. Fluoride is an important mineral that is incorporated in our faucet water, our toothpaste, and mouthwash, and also in food. Fluoride is very important because it helps strengthen our teeth by providing minerals. Let's talk mouth rinses. To name a few of the benefits, they can prevent caries, control biofilm, and control bad breath. Types: there are therapeutic and cosmetic. Therapeutic mouth rinses, they can reduce plaque, fight bacteria, protect the enamel, and control bad breath. Cosmetic mouth rinses, they temporarily control bad breath, they have a pleasant taste, and they do not have the ability to kill bacteria, but they may help remove some stains.
Diabetes and dental disease. So tooth and gum problems can happen to anyone. A sticky film full of germs called plaque builds up on the teeth. High blood glucose helps germs and bacteria grow in the mouth. As a result, you can experience red, sore, and swollen gums that bleed when you brush your teeth. People with diabetes can have tooth and gum problems more often if their blood glucose stays high. High blood glucose can make the tooth and gum problems worse. You can even lose your teeth. If smoking is involved, it makes it more likely for you to get a bad case of gum disease, especially if you have diabetes and are over the age of 45. Red, sore, and bleeding gums are the first sign of gum disease. These problems can lead to periodontitis. Periodontitis is an infection in the gums and the bone that holds the teeth in place. If the infection gets worse, your gums may pull away from your teeth and make your teeth appear longer. This is often referred to as gum recession. If you are experiencing red, sore, or swollen gums that are bleeding or pulling away from your tooth, bad breath, or loose or sensitive teeth, then you may have tooth and gum damage from diabetes. It is important that you visit with a dental hygienist and dentist to properly prevent, treat, or control the development of dental disease. And lastly, here are some services that Del Mar's Dental Clinic offers to the community at no charge. Thank you guys for watching.